busy people getting fit in Fulshear, Texas. Our aim is to help you look better, feel better, and perform better as quickly as possible. I'm your host, Bryan White with Blue Eagle Fitness and Nutrition. Welcome. Hey, what's up, everybody? I am here with Dr. Melissa Hurwitz, and she was telling me about this wonderful weekend that she had, but then she's halfway through the story, and she's like, no, it wasn't that good of a story.
It wasn't. It wasn't.
But anyway, what'd you do this weekend?
Yeah, so took my son and my husband and my son. We took our son to go on we call it a play date. It's not really a play date because it's really more for the adults and the children just have to sit there. But we went to this nice restaurant, arguably maybe too nice to bring children to, with another couple. And our son, who is 18 months old, wonderful, like super happy kid, just was kind of a terror. And the other kid, who's about his age, was absolutely delightful. Just so quiet and wonderful, and even motioned for the check, and just very smart. And my son, of course, who's normally just like an angel, and
sure,
he really is good.
Sure.
But he's, as you can see, you can't even hear him right now. He's in the other room. But he's crying, fussing, wanting to get out of the high chair. But the poor kid, we kind of kept him in the car seat all day. I guess we were taking him around doing things. So, anyways. But it was fun. The food was good.
And you were with another 18-month-old who apparently was calling for the check.
Yeah,
so good for him.
It was
good
amazing.
For him.
Yeah.
Well, we're here today to talk about plantar fasciitis.
Mm-hmm.
Okay, did I pronounce it correctly?
Yeah, totally.
Okay, I can sound like I know what I'm talking about. So tell us what it is and who gets it.
Sure. So plantar fasciitis is maybe... I hear Stan.
No, he's crying. It's okay. It's okay.
Hopefully she'll get that under control.
Right.
Plantar fasciitis is... Oh.
Okay. We just got the thumbs up that we're doing okay.
I think he's looking for me. Oh, no, he saw me.
Okay.
Wait. Uh-oh. Oh, no. Hi, baby. Okay.
My 16-year-old babysitter's not doing her job right now.
That was very dangerous territory. Okay, so anyways, plantar fasciitis is a condition that affects a lot of people, and especially a lot of people that come into our practice. I would say on any given day, maybe anywhere from 20 to 30% or more of my patients, I'm totally making this up, but it's somewhere around that range. A good chunk of our patients do have it and come in for it.
Okay.
It's a condition that primarily affects the heel. Okay. Usually people just call it heel pain, but it can even be arch pain. Even though there's a lot of different diagnoses and other foot conditions that can also cause heel and arch pain, I would say probably the most common cause would be arguably plantar fasciitis. So what causes it, we don't necessarily know. The way I like to describe it, as an understanding for people that come in, maybe have had it for 1 week or a couple of months, it's all different people that get it, for all different spans of time. It's really when you start to experience heel pain, a lot of the times out of nowhere. It'll start one day. And the main cause, the way that I like to think of it, is kind of a load capacity issue. Okay. So your heel and the structures on your heel, the main one we're talking about today being the plantar fascia, it accepts a certain amount of load every day just from you're doing your certain activities or whatever you do at your work on a daily basis. And when the capacity is met, so maybe it's time, maybe it's maybe you're overdoing things, you're doing new exercises, whatever it could be, age, right? There's actually a lot of different factors that could feed into this, but once the load exceeds the capacity, you start to have irritation where the plantar fascia attaches, and that's basically on the bottom part of the heel, which now I'm almost wishing I brought a foot model to point it out to you. But as you can imagine, if this is my heel and this is the bottom of my heel, it's pretty much that simple. People a lot of the times first come in complaining of, getting out of bed, the first thing they experience, pain when they step down first thing in the morning, right? That's pretty textbook plantar fasciitis. I do have some people also that, say that they have heel or arch pain and it kind of manifests in different ways. It may be a different thing other than plantar fasciitis. It may actually be plantar fasciitis, and that's just how they are manifesting it. But typically it's going to be, you're off of the foot for a period of time. You're either sitting down or sleeping. You get up, and that's usually when it's the worst.
Okay.
A lot of times, even with plantar fasciitis, it actually tends to get better throughout the day, or maybe it's worse at night. But that's most things that are painful. A lot of people find can be a little bit more sore at night. What the plantar fascia is basically it's thick tissue that essentially holds your arch in place. So it attaches on the bottom of the heel, attaches to most of the structures, like most of the foot bones. And the way that you can identify your plantar fascia is I don't know if you want to do this right now, you'd have to take your shoe off. But if you can imagine, you take your shoe off and you kind of hyperflex, or we call it dorsiflex, or you basically push up the big toe at the base, right? Yep. And then there'd be a band of tissue that kind of sticks out. Do you know what I'm talking about? Yeah. It kind of almost feels hard when you do that. Like when you push it like this, you're going to feel that band. And if you looked at
that runs through like my arch.
Yeah, exactly.
Okay.
So that is your plantar fascia.
Gotcha.
And yeah, I think so. I kind of describe it to my patients as a ligament. It's not a ligament. Okay. Ligament has a very specific definition. It's basically. It's ligamentous tissue that connects bone to bone. But that's the reason why.
I'm saying correct to a doctor, but whatever.
Ligament, it's if you want to get like technical, right? Like I'm sure if there's a doctor watching this, they might be like, well, it's not a ligament. It's not. But I like to explain it to patients because, like you said, like it doesn't matter, right?
Correct.
Like if I said it were ligament, you'd be like, okay, fine, it doesn't matter. But it's fascia. It's tissue. It's similar to ligamentous tissue, but it's thin. It's like a thin sheet of tissue that kind of spans the bottom of the foot and is one of the most important structures that holds your arch in place, that gives you an arch when you step down.
Okay. And so if I experience this heel pain, you diagnose it as plantar fasciitis. What's the treatment?
So, you skipped ahead a lot.
Oh, did I? Sorry. What did I skip?
Well, to diagnose it.
Oh, we haven't diagnosed it yet.
We haven't diagnosed it yet. I mean, you come in and you tell me you have heel pain.
I have heel pain.
You have heel pain, right? But let's just say maybe it is like when you first step down in the morning or not. Like first thing we're going to do is take an x-ray. We want to rule out some other more pertinent things like maybe
a broken foot.
Like a broken foot. Fair, right? So that's definitely one of the possibilities.
Okay.
There's a couple other, but not to get too, I can really tangent, so I'm going to try to not do that. But a good example would be like a stress fracture would be something that we could find on an x-ray. And another thing actually I want to say, because a lot of patients do come in telling me, hey, maybe I had x-rays somewhere else, my GP called it for whatever reason, I have this heel spur. That's like a big thing that people come in talking about when they think they have plantar fasciitis, when they've been told they have plantar fasciitis. And I do want to say, I say this to my patients all the time, a heel spur, yes, you may have it. It may be associated with plantar fasciitis, but it's not really a factor in treating it. Okay. And in fact, so I may note on the x-ray, hey, you have this little hook of bone on the bottom of your foot. That's where the plantar fascia attaches. I don't like to get too caught up on that. Like if I were taking x-rays to only find that, I wouldn't even do the x-ray. Okay. But I'll always mention it. And sometimes I'll even see a little spur where the Achilles attaches, which I'll talk maybe a little bit more about later when I talk about the causes of it. But basically, when it comes down to it, I would say there's studies that show about 80% of people who get this condition resolve it in about a year. Okay. And that doesn't mean that it will take a year. Some people it resolves in a week. Some people it resolves in a month, 2 months. There's no exact predictability on that. But pretty much, I would say in my practice, 100% of those people, I should say 99, nothing's ever 100%, but pretty much we don't really take into account the heel spur. Like that doesn't do anything. It doesn't mean anything. So I'm sorry, what were you jumping
You're diagnosing plantar fasciitis.
We've diagnosed it.
We've diagnosed it because you took an x-ray.
Yes.
Anything else?
Actually, yes. I'm glad you asked.
Because the x-ray just told us that it wasn't broken and no stress fractures.
Correct. Okay. One of the other main things, and I'm assuming, I think most doctors take this into account when you're talking about plantar fasciitis, but especially me, I will say I really like to pay attention to how tight your Achilles is. Okay. There's a muscle group that the Achilles tendon is the biggest, thickest tendon that attaches to the back of the heel. And it's made up of 3 muscle heads. So one of the muscle groups that makes up the Achilles tendon, it actually attaches to your femur, where your thigh is in the back, and your hamstring group, right? So basically, I like to pay attention to that because it's kind of it becomes a whole part of the algorithm in treatment, which we like to really employ stretching exercises for the hamstring group. But we do a special test in the office to just see if there's a big contributing factor of one of those muscle groups. And if so, it kind of does impact the way that we treat the condition. Achilles tightness, it's not just the Achilles, right? But like, just to keep it simple, I tell my patients, the pulling up of the Achilles, the tightening of the Achilles, whatever's contributing to that, if you think about it, right? Imagine your Achilles is completely taut, like if you almost like you're pointing your toes down, because that's what it'd be like, right? So if your Achilles is a little bit tighter, then you have your plantar fascia kind of playing a tug of war from the bottom. That's certainly not going to make it better, right? So I in part of the diagnosis, and I think also coming up with the treatment plan, which I know we're excited to move on to. I do like to talk about, how the Achilles factors in, or a part of that muscle group, and how we can use that in our treatment plan to hopefully cure it for you or be on your way to getting better.
Okay.
So treatment, right?
Anything else before we get to treatment?
I really scarred you. So no, I think that's the easiest, simplest way. Well, maybe one other thing I could mention. I don't really do this as much anymore, but it can be done. And another thing that you can use to measure if someone has plantar fasciitis, that in theory could be used. You hear something?
No, okay.
That in theory could be used in the diagnosis, right, would be ultrasound. I would say, I go through periods of time where I'm doing it more or less often, but basically when you do an ultrasound, right, on someone who you suspect to have plantar fasciitis, it should show thickening of the plantar fascia. So a normal plantar fascia is about 3 millimeters. When we look at an ultrasound, a lot of times people with plantar fasciitis will have increased upwards of 5 to 6 millimeters.
Okay. Wow.
The reason why I don't do it all the time, or I don't necessarily do it as much in my practice, is just because I know that the studies do say essentially there's not a real correlation with prognosis and getting better in thickness. Like you may not have any heel pain and I could measure that you have a thick plantar fascia, or you may have a thick plantar fascia and pain and we get you better and it's still thick. So that's the reason why it can be helpful sometimes to really, if we're really confused or we really want to see if that's going on that way. But and that's pretty much it for diagnosis. And then so treatment, right? So treatment for plantar fasciitis, I mean, everybody, I'm sure all doctors that you go to for this have their own protocol, but a lot of them are really similar. The standard of care a lot of the times with plantar fasciitis, we all start with stretching your hamstring, Achilles group. I mean, first of all, couldn't hurt. And secondly, a lot of the times, probably more often, I believe that the Achilles, the muscle contributing to the Achilles group that may be in question that I was talking about before is contributing to it. And, I do find in practice that many of our patients do get better just simply by doing stretching. But
this is static stretching for the hamstring and the Achilles.
And there's like a whole set, like if you look online, we have our own little packet that we like to give out to patients. There's a couple of other little wacky little things you can try to do we have it in our packet, and physical therapists will swear by it, I'm sure, and I'm not trying to foo-foo it or anything like that, but I mean, for example, one of the things is you can pick up marbles with your toes, and what that's supposed to do is that's supposed to strengthen it's supposed to strengthen the...
Do you have marbles at home?
I can't say that I do. I feel like I've just been called out. I feel like attacked. I feel like I need to get marbles. I'm just saying
that this advice might be about 30 years old.
Maybe. And maybe I should look at the newest research on picking up marbles with your toes.
Or grapes. Grapes.
That might get weird, but you might end up making wine.
I'm just saying that I have grapes and I don't have marbles.
You know what? It might get a little squishy. You may not achieve the results that you were intending to, but for all I know, maybe it's even better. Maybe you're onto something.
Maybe so.
But what it's supposed to do is supposed to strengthen the intrinsic muscles, which are these really teeny tiny muscles in deep within your foot, to basically increase the, I guess it's supposed to create a more supported foot. So if your plantar fascia is lacking, if it's weak, if it's, inflamed, the idea is you have stronger muscles in your foot, kind of like, I'm sure you understand this, like with any other injury. A lot of the times, like if somebody has an injured, I think your computer is.
It's fine.
If you have an injured ankle, for example, right? A physical therapist, one of the things they're going to do is strengthen the muscles all around the ankle. It's kind of like that in a way, right?
Okay.
But I just say it's wacky because it's like, I'm not going to say that's like the main thing that gets our patients better, right? Like, I don't think the patients that are not picking up marbles are the ones that are in deep trouble here. So we have stretching. Stretching, exactly. Another, I would say, standard of care thing that's, probably like an age-old thing that people will try to do is icing. I know you and me have talked about icing, icing versus heat. I personally think that, applying heat can also help, especially if we're in a chronic phase, like maybe we've had it for several months. There are newer studies that are out that do show using heat does have its benefits. So, but that would be something. Ice versus heat, I almost think you could do both. I mean, I don't think there's any harm in using ice. One of the things that, again, is like an age-old like therapy for this is like you take a water bottle, leave it in the freezer, kind of massage the bottom of your foot. I still see no harm in that. Manual massage therapies can always be helpful in, relieving inflamed areas of the body. And then, other things that we use that I find to be very helpful, either over-the-counter or custom inserts, depending on the relative deformity of the patient or, what kind of use is this patient's foot getting. I mean, I have some people who are like elite athletes or a librarian, and you may have a different need. And so we come up with things that are effective but also make sense to the patient, right? Yeah, I was going to eventually but we can get to it now. The shoes. Yeah, shoes. Shoes are also a thing. I don't know how I even just happened to leave that out. I always talk about it. Basically, in short, for most conditions, I will say there's little things that like if you're pronator or supinator, we can do that another time. But generally speaking, a good shoe with good shock absorption, which how will you know that? I mean, it's usually going to be like a thicker and stiffer sole. All the shock, think of it like this. When you're walking barefoot in the home and you have heel pain, right? Like you step down first thing in the morning, you step on a barefoot. So your foot's taking all the shock absorption, right? From through your heel. So if you put on a supportive shoe with an insert or without, the more support that you have, right? Like for that area, the less shock that your actual foot is taking. The shoe is taking it. The insert is taking that shock when you step down, all the, the force of your body weight, gravity, and stuff like that. So another good point that I think this raises is patients, a question that I'll usually ask people is, are you barefoot in your home? And most people would say yes. I mean, I think it's sometimes like almost weird if you don't say yes, because most people do when you get from the outside, right? You come inside, even for cultural reasons or sanitary reasons, you're going to take your shoes off, right? So that's fair. Like, and right after I asked that question, some of my patients have gone, to the extent of getting a more supportive insert, or I should say, whatever footwear for the home. But that's one of the first things also that we tell people on their way out when we're talking about, all the things that we're doing together for this condition is when you step out of bed in the morning, have a step into like kind of special shoe, whether it be, I know you're in the home, but have it be like your home shoe. Maybe it's a Birkenstock sandal or, some kind of sandal with support, like a slip-on device that support. Slippers, they're not really going to give you support, right? Like maybe some do, like if you have one that's actually like, relatively stiff. I mean, you'll know if you can bend the thing completely in half and touch the front to the back, that's not supportive, right? Like just like a Chuck Taylor sneaker. All of you watching this, if you are still watching this, Chuck Taylor sneakers, very popular, the Converse style, and it's just no support, right? They look good, they're cool, kids have them, you look cool, they're classic, but unfortunately not very supportive. So those are the things. So we touched on stretching. Actually, one other important thing that I try to get a lot of my patients to do, because there's evidence-based medicine behind it, is a short course of non-steroidal anti-inflammatories, which is your Motrin, your ibuprofen. I like to prescribe it because I think it increases compliance. Like instead of like you thinking to reach in your medicine cabinet, if you have like that prescription there that says take one in the morning, one at night at this degree or at this dosage, right, that I want you to take, I really like it. Some of my patients like for whatever reason, I feel like I've explained it, and they'll come like, yeah, I took 1 or 2, but no, I want you to take 1 in the morning, 1 at night. That's just kind of one of my things. But in general, right, like using a short course, so not for the rest of your life, but like maybe just a few weeks, can actually, there are studies that have shown positive evidence and correlation and reduction in symptoms and pain by adding this on to the full gamut of things that we do.
Okay. Okay. Anything else we need to know?
I suppose not. I mean, I think that's pretty much it. I'm sure there actually is, right? But like, then I'm going to give everything away and you're never going to come and see me. No, I'm just kidding. No, it's really, I think that it's fair to try some of these things, right? Like, when in doubt, it's always good to get an x-ray first. Come see the doctor, even if you already know some of these things. I mean, like I said, some people will get better sooner. Some people will need some time, and there's not always an answer to every question. I know some people, having foot pain in general can be really frustrating. I have a lot of patients often will come in tearful, actually, like that it's still there. They maybe have 5 kids. They don't have time to get better, and they can't get better. I mean, there are actually a lot of other treatments that we could potentially do, but it really just depends on your level of symptoms. Like what I'm talking to you about is kind of the most basic stuff. Like if you go on Dr. Google and you look on the internet for plantar fasciitis, a lot of the times, you will find, and some of my patients come in and maybe they did it, like they kind of did it, but like, not to the degree that they should. They may need other things that we can provide for them. And so, yeah.
Okay. Mm-hmm. Well, thank you very much.
Totally.
This is a popular question, so I'm glad we got it covered.
Yeah, hopefully that helps. And definitely if you are in the area or not, we're happy to help you.
Excellent. Love it.
Yeah.
Well, thank you. And we'll see you next time.
Can I do this?
Yeah, absolutely.
This is I don't think this is going to be very professional looking, but this is our practice, Fulshear Foot Ankle.
And there'll be a link in the show notes with all the contact information you need as well.
Love it.
Awesome.
Thanks. Thanks for having me.
Yep. Bye.
Bye.
You can get every episode of Busy People Getting Fit wherever you listen to your podcast or on YouTube. You can also reach us at busypeoplegettingfit.com. Until next time, thank you for listening.